This is Beth Bartleson reporting on Article Critique 3. The main purpose of the study was to examine the associations for each metabolic syndrome criterion and muscular strengthening activity MSA patterns. This was done by comparing the odds specific to having each metabolic syndrome component among individuals report engaging in a level of MSA greater than or equal to 2 days per week to those reporting no MSA. Researchers also examined the potential dose-response relationship between the increasing levels of MSA and metabolic health outcomes. The design is a cross-sectional study that used 6 years of data from 5,618 male and female adults greater than or equal to 20 years of age who participated in the National Health and Nutrition Examination Survey, NHANES, between 1999 and 2004. These participants were required to attend a mobile examination center exam following an overnight fast of a minimum of 8 hours. Complete data for all variables of interest such as physical activity, diet, and current medical conditions, and if female, they cannot be pregnant. Physicians conducted exams including blood pressure readings at varied interval, waist circumference measurements, and complete blood profiles including lipid and glucose levels. Cutoff points for metabolic syndrome criteria were derived from the American Heart Association National Heart, Lung, and Blood Institute definition. Aggregate data on weightlifting, push-ups, and sit-ups were used to establish patterns of MSA. The participants that reported greater than or equal to 2 days per week of MSA were coded as meeting current U.S. MSA guidelines. The data was then analyzed to determine whether or not there was a difference in the prevalence and risk estimates of individual metabolic syndrome criteria among U.S. adults who report engaging in various levels of MSA. Following adjustments, study participants that reported greater than or equal to 2 days per week of MSA were found to be 28% less likely to have dyslipidemia, 29% less likely to have impaired fasting glucose, 19% less likely to have prehypertension, and 43% less likely to have augmented waist circumference compared to those participants that report no MSA engagement. There was no association found for hypertension and MSA. Strengths of the study is that it's the first of its kind known to the researchers to examine the associations between individual metabolic syndrome criteria and engaging on a level of MSA that meets the most recent Department of Health and Human Services physical activity recommendation in U.S. adults. Another strength of the study would include the large sample size. The study also showed that engaging in greater than or equal to 2 days per week of MSA as part of an overall physical activity regimen is prudent to metabolic health and further strengthen the relationship between MSA and metabolic health proposed by the researchers. This would allow clinicians to include muscular strengthening activity when discussing lifestyle approaches with their patients. Weaknesses include the cross-sectional nature of the study, which precludes establishing directionality of the association. MSA questions were subject to social desirability bias. The odds ratio may be viewed as a measure of association rather than approximating prevalence ratios, and excluding participants who used various medications may have affected the estimated odds ratio. Thank you.